Most of the children with epilepsy, most of the children can actually be treated with medication, and about 70% of children we can get good control of their seizures with medication. And that is usually our first goal because it's probably the easiest way to treat epilepsy. If you can take a pill to treat the seizures, and many of these children can ultimately come off the medication because they outgrow their seizures. We think that's probably the lowest risk treatment for epilepsy. In the children who have seizures that don't respond adequately to medication, and these are children who can have various type of symptomatic generalized epilepsies, Lennox-Gastaut syndrome, myoclonic astatic epilepsy, Dravet syndrome, some of the more severe early onset seizure disorders, West syndrome or infantile spasms. Those children may not be good candidates for surgery, but those children can be very good candidates for starting the ketogenic diet. The ketogenic diet is a diet that's high in fat, very low in carbohydrate, so it's a pretty strict diet that the family needs to stick to for the child, but most families do that very, very well, and we have great support here from our dietitians. And so in that situation, we actually will bring the patient into the hospital and we'll start them on the ketogenic diet. It's usually about a 2 or 3 or 4 day admission. They get started on the diet and then they go home. And that can be very helpful for children with epilepsy. And in some cases, we can actually get the child seizure free or have significant reduction in seizures.